Welcome to our webinar. We will begin promptly. Make sure your speakers are turned on. You will be muted during this webinar. Please use our chat to ask questions to our presenter. As a friendly reminder, this webinar will be available on our YouTube channel. You can download the PDF of today's presentation. Once again, welcome. We're glad you could join us. Welcome to our webinar. We will begin promptly. Make sure your speakers are turned on. You will be muted during this webinar. Please use our chat to ask questions to our presenter. As a friendly reminder, this webinar will be available on our YouTube channel. You can download the PDF of today's presentation. Once again, welcome. We're glad you could join us. The National Hispanic and Latino Mental Health Technology Transfer Center was established to develop and maintain a collaborative network to support research development and dissemination, training and technical assistance, and workforce development for Hispanic Latino populations and communities receiving mental health services throughout the U.S. mainland and the Caribbean. We offer free technical assistance. If you want more information, please contact us. The National Hispanic and Latino MHTTC is under the direction of the Institute for Research, Education and Services in Addiction, IRESA, and housed at the Universidad Central del Caribe School of Medicine in Puerto Rico, and supported by the Substance Abuse and Mental Health Services Administration, SAMHSA, of the U.S. Department of Health and Human Services. As mentioned, the Mental Health TTC network is funded by SAMHSA. SAMHSA strives to reduce the impact of substance use and mental health disorders on U.S. communities throughout its programs and services, and demonstrates that behavioral health is essential to health. Prevention works, treatment is effective, and people recover from mental and substance use disorders. You can learn more about SAMHSA by visiting www.samhsa.gov. And now our moderator.
Hi, everybody, and welcome to today's webinar, La Clave, to reduce treatment delay in Latinos with first episode psychosis. I'm going to introduce you now to our presenter. Steven Lopez is a professor of psychology and social work at the University of Southern California. He teaches undergraduate and graduate students on how to consider cultural issues in their everyday lives and in their research and practice. His research addresses how to improve mental health services for Latinos in the United States and Mexico. He has published over 100 journal articles and book chapters during his 37-year career as an academic. In addition, Dr. Lopez maintained a small clinical practice for several years in both public and private mental health facilities. For 15 years, he was the director of an NIH-funded summer research training program in Mexico that trained 130 undergraduate and graduate students in Latino mental health research. He is currently the principal investigator of a National Institute of Mental Health funded project to reduce the duration of untreated psychosis among Latinos in Los Angeles County. So now that we know our presenter, let's get to know our audience. So we're going to begin with our poll questioning. So our first question, do you currently serve Hispanic and Latinos with any serious emotional disturbance? So 63% of our participants say yes, 38% say no. Our next question, are you planning to serve Hispanic and Latino populations in the next 6 months? And we have 79% of our participants say yes, 13 no, and 9% don't know. What is your current professional role? And we have 20% social worker, case manager, 26% counselor, therapist, psychologist, 23% faculty research student, 9% government official policymaker, and 26% other. What type of setting do you currently work in? And we have 29%, 30% university higher education, 37% treatment, 14% government, 19% other. So now we'll go to our pretest. Most initiatives to reduce treatment delay of persons with first episode psychosis have been successful. True or false? Okay, so 33% of our participants say true, 68% say false. La CLAVE is an acronym that identifies the key symptoms of psychosis. True or false? Okay, 75% say true, 25% say false. And our last pretest question, Greater delays in treatment from the onset of psychotic disorders are associated with worse functioning and poor treatment response. True or false? Okay, so 97% say true, 3% say false. So that's it for poll questioning. And now I'm gonna hand over the controls to our presenter, Dr. Lopez.
Ok, dale aquí a sharing.
Dame aquí.
También es lo mismo. También esto, espérate. Ok. Dr. Lopez?
Yes.
Yes.
There you go.
We can see your screen.
Okay. Let's, okay. Am I ready to go?
Yes.
Okay.
Thank you.
Thank you very much. I'd like to thank the National Hispanic and Latino Mental Health Technology Transfer Center. I'd like to send a thanks to Dr. Daris Orobich for inviting me to be here with all of you. It looks like about 50 people have showed up. And I want to thank you for showing up as well. I appreciate that. As you can see, the purpose of our talk today is to talk about how to reduce the treatment delay, particularly of Latinos and particularly Spanish-speaking immigrant Latinos in addressing issues of first episode psychosis. As many of you know, first episode psychosis is a really chaotic, difficult, challenging time for folks. And having the knowledge about what psychosis is, what serious mental illness is, can really reduce the burden on the individual with the illness as well as their family and also service providers. So I'm going to suggest ways, point out ways in which we can do that. But to begin with, I'd like to share with you a case, a story. We've been carrying out research with families caring for people with schizophrenia and psychotic disorders for a number of years now, and this is one particular case. We changed his name. But according to the sister of Ruben, he's been a little on the aggressive side since he was born. But it really turned became worse when his father died. This was around 13 or 14 years old. Sister noticed that he was hanging out with the wrong crowd, becoming more aggressive, withdrawing from the family. And so to address this, the sister thought, and the family decided it'd be best if he just got out of this negative environment and sent him to his brother, who was at the time working in Europe. And so he stayed a year there, came back a year later, continued to be aggressive. Again, they returned him to his brother in Europe, and he came back another year after being there. And really the family noticed no difference. And it turns out that the sister is a nurse, and she was thinking, maybe I'll consult with one of my colleagues who is a physician. And they did. And the physician said, you know, he really does have a mental health issue here, but he's not really, can't be hospitalized involuntarily. He has to go on his own accord. Finally, they actually sought care from a psychiatrist, and the mom said, mi hijo no está loco, my son isn't crazy. And she didn't want him to seek that service, and they delayed further. Bottom line is that it took 4 years, according to the sister, when he first began his psychotic illness, it took 4 years for him to get the treatment that he needed. And those 4 years weighed heavily on his life. During those 4 years, he wasn't going to school, he wasn't working, he wasn't developing relationships, and that can be prevented. Those delays can be prevented. So the main goal of this webinar is to describe a campaign that's directed at largely, as I said earlier, Spanish-speaking community to reduce the treatment delay for persons with psychosis, particularly first episode psychosis. I want to also present the rationale and the conceptual model that underlie the campaign. And I want to talk about 4 resources that we've developed and tested in terms of increasing people's knowledge and understanding of psychotic illness. And then we'll spend some time reviewing what the campaign consisted of, and also talk a little bit about the preliminary findings. And finally, I'd like to share with you a couple of key ideas that we learned in carrying out this campaign. So in terms of the rationale, there's good evidence that the longer that somebody goes without treatment from the onset of the illness, the longer that they go, and this is called the duration of untreated psychosis, the longer they go without treatment for first episode psychosis, then the worse symptoms become. And then also the worst social functioning occurs. And then there's also good evidence, John Kane and his group, that indicates that people with longer treatment delay have worse treatment response. The earlier treatment delay has better treatment response. So if you think about the case of Ruben, his social functioning clearly was not where it should have been, given the fact that he didn't receive the services. It's likely that his symptoms would have been less developed, and it's likely that he could have been benefited more from treatment had he been treated early. So this is the main rationale. Like any other disorder, cancer, diabetes, the earlier that you get treatment, the better outcomes for the individuals. And so this research led to the development of early detection and treatment services. I must say that it's Scandinavian countries, Norway, Denmark, and Australia that have led the way. And they've developed 2 particular components. One is the early detection. This consists of campaigns, initiatives to get the word out in the media, to meet with people, public groups, to get the word out, to identify early on folks who need treatment. So that's one component that's been developed. And then the second component is early intervention. And here in the United States, it's referred to as coordinated specialty care. This is a set of treatments that are needed to really improve the outcomes of people with first episode psychosis, and includes personalized medication management, includes supported employment, education, family psychoeducation, individual therapy, oftentimes cognitive intervention, and other components as well. And so the prior research has supported the identification, the need for detection and early treatment services. And the really key idea is that psychotic illnesses can be treated and the burden can be reduced. Okay, well, there are a number of limitations to this line of research and to these initiatives. One key limitation is that there's been little attention to the ethnic and racial diversity within communities. For example, the one first study to demonstrate a reduction in the treatment delay based on a campaign and clinical services, they excluded anyone who spoke the non-native language, the non-language that was used in that particular country. And so there's also been limited consideration of culture in campaigns. So for example, in Singapore, there's an important study that indeed reduced the treatment delay, but the only consideration that they made in terms of the content of the campaign was to actually have different languages in Singapore for the particular television program that was being broadcasted. But in terms of the content of the campaign, there's been little attention to the content. Another limitation that's not noted on the screen is that of most of the initiatives have been unsuccessful. There have been few who've actually intended to reduce the duration of untreated psychosis or reduce the treatment delay. They've actually reduced it. In fact, in a meta-analysis, the effect size is pretty close to 0 after a number of studies have attended this now. There's good evidence that 3 or 4 groups have actually succeeded in reducing the treatment delay, but most have not. All right, so the fact that there's little attention to ethnic and racial diversity, and the fact that there's little consideration of culture, we believe that this is a significant oversight because of the diversity in the globe and also here in the United States in terms of immigrant and minority communities. Now, to our knowledge, there's no study to look at the treatment delay, assess the duration of untreated psychosis or treatment delay of Latinos here in the United States, but there's good evidence given Margarita Alegría and her national study of Latinos that adults of Mexican origin are really tend not to use mental health services, and also Spanish-speaking and immigrant Latinos tend not to use mental health services. These are for substance abuse problems. These are for depression, anxiety. To my knowledge, there's no national data with regard to schizophrenia and psychotic disorders, but good evidence that Latinos, and particularly people of Mexican origin and immigrants and Spanish-speaking, are not likely to use services. And obviously, Latinos are the largest ethnic minority group here in the United States, and they're also the largest minority group here in the state of California. And immigrants represent a considerable proportion of Latinos. So given that prior research with regard to the duration of untreated psychosis and implications for treatment and functioning, and given the lack of attention to issues of culture and diversity, and given the need for Latinos to get into services right away, we developed a campaign that we carried out here in the Los Angeles County, specifically in the San Fernando Valley, carried out a campaign to reduce the duration of untreated psychosis of Latinos. And specifically, the campaign was directed at the general public. So we would reach out to church organizations, schools, community organizations, social service agencies, law enforcement, the like, to get the word out. In addition, we reached out to professional networks, health providers, mental health providers, and as I mentioned, criminal justice as well. So our focus was not on the clinical side. We did not have a clinic that had coordinated specialty care. Instead, we carried out a campaign that was coordinated or to get folks into the standard mental health services in the San Fernando Valley at that particular time. So our hypotheses are, we had 2 main hypotheses. One is that we'd expected to see a decrease in the duration of untreated psychosis compared to pre-campaign baseline. And secondly, we expected to see that immigrants would have a greater delay in the duration of untreated psychosis compared to US-born Latinos. All right, that's the background and the rationale. Now let's turn to what the actual campaign consisted of. Well, we thought that it would be really important to think conceptually about what the issue is. What is it that delays treatment? Clearly, there's structural issues. Not having Spanish-speaking mental health professionals in community centers is a big issue. The current political climate that does not encourage folks to reach out to public clinics. That's an important issue. The lack of mental health facilities in given communities is an important issue. And also the financial aspects are really critical. Our campaign didn't address those issues as much as it was getting information out, establishing a dialogue, establishing a conversation in the community. And so that's what we saw our role. And so our campaign taught community residents how to address symptoms when they came up. As you can imagine, people with the first episode of psychosis, it's really confusing. It's really challenging. It's really chaotic on occasions and really, really difficult, a difficult situation. And so in our prior research, we've noted that oftentimes what happens is that families see the initial signs of an illness. But instead of considering that it's a significant mental illness that's going on, they attribute it to other factors. So they attribute it to factors that are going on in their social world. For example, if they're having difficulty at work, they think it's the stress related to work. Or if it's an adolescent going into adulthood, some family members have told us that they thought this was part of that transition from puberty into adulthood. Think of the case of Ruben that we mentioned at the beginning, that family members thought it was the negative influence of folks. Sometimes people make attributions to drug use as well. And what concerns us is by attributing things to the ongoing social world, that they don't consider the possibility of a serious mental illness. So our campaign was informed by this conceptual model that we drew from actually the Institute of Medicine's health literacy, important volume and prior research. And the idea was that if we could increase health knowledge, specifically knowledge about psychosis, that we would increase then the illness attribution and not the social world attribution. And then by attributing it to the illness, we would see greater help seeking in terms of to address the serious mental illness. So this was the conceptual model that guided our campaign and informed our message. In addition to having a conceptual model, we thought it was really important to use language that people could understand. Instead of using words like schizophrenia, using words like psychosis, we thought it would be really important to use everyday language. And we wanted to make everyday language accessible, something that people could remember. Too often we've seen families come in and family members speak Spanish or not, don't remember the diagnosis of schizophrenia. These are hard terms for many folks to keep in mind. So we came up with a mnemonic device or an acronym. Essentially, my wife is from Puebla, Mexico, and she teaches Spanish. And I told Leticia, I said, Leti, can you help me out here? I want to come up with some kind of way to help people remember ideas of psychosis. And so one thought that I had was see cosas, see things. And she says, as my supportive wife tends to be, she says, that's not a good idea. And I said, why not? She says, because it's in English and Spanish and you want it for Spanish speaking folks. Okay, help me out here. So she took her thesaurus, Spanish language thesaurus, and took Velázquez, the bilingual dictionary. And about an hour and a half later, she says, this is the best I can do. And I said, well, what is it? La clave. La clave. Well, I'm not a native Spanish speaker. But I've improved my Spanish over time. And I said, well, what is la clave? And she says, it means the key, it means a guide, it means a clue. And I said, well, why clave? And she says, this is with the help of a cartoonist that we sought help with. She says, C is for creencias falsas, which are delusions. L is for lenguaje desorganizado, creencias falsas, lenguaje desorganizado, so disorganized speech, cognitive issues, possibly thought disorder, and A or A for alucinaciones. And what type of alucinaciones? Ver cosas que no existen, see things that don't exist, o escuchar voces o sonidos, hear things that don't necessarily exist. So use la clave to detect, para detectar la enfermedad mental grave. And if you use la clave, it's easy to remember creencias falsas, lenguaje desorganizado, alucinaciones. And so the mnemonic and acronym has informed our campaign in many different ways. This is just one example, but this is a brochure that we use for Spanish-speaking folks. And you can see that we use these icons to illustrate this. I should point out that I traveled quite a bit in Mexico, and I'm always impressed in the metro in Mexico City that you don't have to read or write to know which stop to get off on. For example, I used to get off on General Anaya, and it had a Napoleonic cartoon feature, and I knew that was General Anaya. and I didn't have to read. And so we came up with these cartoons as well to help people think about what La Clave means. So in addition to the conceptual model, and in addition to the mnemonic device, we've been really tried hard to come up with ways to give folks of any educational background tools to guide them in informing and educating and creating a dialogue in communities. And so here are 4 of our resources. The first resource, La Clave en Vivo, is essentially a series of PowerPoint slides, and it has PowerPoint slides with clips, video clips, and music clips. I'll tell you a little bit more about that. And then with my colleague, Dr. Alex Kapelowitz, who's been a really key figure in our work, he got some funding from AstraZeneca. It had no strings tied to it, and he said, "Why don't we put La Clave en Vivo on video and have it available at the time a DVD, and we could then give it to promotoras, we could give it to mental health clinics, etc." And we call this La Clase. And La Clase is because it's a series of PowerPoints like these, again with the videos and audio clips that I'll tell you a little bit later what that consists of. And then, as I said earlier, we've done research in Mexico, and we were working with promotoras in Puebla, Mexico, and we were giving them the La Clase DVD. And so to actually, and we wanted them to then show their community the La Clase. But we went to one of their homes to show them how this was done. And we took our laptop to show the DVD. We took our cañón, the LCD projector, and we needed speakers. And I turned to the promotora and I said, "Señora, where's the outlet in her house?" Because promotoras typically work outside their home. And she says, "No tenemos un enchufe aquí." We don't have an outlet here, but in a bedroom some distance away. Fortunately, we had an extension cord and we could gain access to electricity and show that. But it just dawned on us that if we wanted the promotoras in Mexico and other parts to show this, they may not have the electronic equipment or even the electricity. So we came up with a third version called La Clave Sin Luz. A number of students were really helpful in putting this together. And so it's consisting of a story that goes through each of the symptoms, such as in this case, disorganized speech. And it helps people to learn. And we use what we call a rotofolio or a flip chart to actually demonstrate the story and teach them. And then the fourth resource is a movie, a brief movie of 15 minutes. Some of you may have seen the movie Real Women Have Curves. Well, the director of that movie, Real Women Have Curves, America Ferrer, is in that some years ago. The director of that movie is Patricia Cardoso, who's Colombiana, and she directed our film. And then also some of you may have seen the movie Coco. Well, Miguel, who's the main character of that movie, has a very small role. I like to say that we helped launch his career, which really isn't the case, but nonetheless. All right, to give you an idea of some of the content, particularly of La Clave en Vivo and also La Clase, I mentioned popular video and audio tapes. And again, trying to make it accessible to folks. So we introduce the whole issue of locura with Chespirito. Some of you are familiar with Chespirito, in particular, Chaparrón Bonaparte and Lucas. And they talk about locura. Creencias falsas, we use El Muelle de San Blas, a song by Maná, to illustrate delusions. Lenguaje desorganizado, we use a clip from El Bolero de Raquel, a movie well known in Mexico and Latin America, and where Cantinflas goes from one idea to the next without relating them. And then Alucinaciones, this is for the Puerto Ricans in the group. Son by Four has a great song called Sofía. And Sofía enloqueció cuando su mejor amiga la traicionó y marchó con el amor de su vida. Se le ve tirando besos al aire como si hablara con alguien y a su lado no hay nadie. So in the words of this song by Sofia, they illustrate hallucinations. In addition, we use a song by Sebastian, by Ruben Blades, Sebastian, and another song by Aldo Mojes. But the idea here is that we try to use popular cultural icons to illustrate these key concepts. This is an example of this movie, a picture of Bolero de Raquel. The idea being that it's not about an educator delivering the message. It is, there are educators delivering the message, but it's trying to do it in a way that entertains people, engages people, and the like. This is La Clave Sin Luz, the story of Olga suffering divorce. She couldn't have kids, and then she starts exhibiting signs of psychosis, such as lenguaje desorganizado, disorganized speech. Now, in addition to developing these measures, we also wanted to test them. And so each of the resources that we've developed, we've carried out studies to assess the efficacy and effectiveness of the resources to enhance psychosis literacy, enhance their knowledge of psychosis. We've used experimental designs, we've used single subject, single group designs, pre-post evaluations, and we've been able to demonstrate that these resources actually increases the knowledge of the signs of La Clave and increase more illness attributions. To give you an example, this is one of my favorite studies that we're in the process of writing up. Andel Nicasio, Angeline Whittier, Carmen Lara Munoz, and myself are the authors. I want to point out that Carmen Lara is a psychiatrist in Puebla, and we wouldn't have been able to do these studies in Puebla without her help. She's been instrumental in developing the message as well as providing access to a lot of the studies in Mexico. But in this study, we used Survey Gizmo, and we carried out a controlled experiment online with 250 students enrolled in the health sciences in a public institution. A third were assigned to La Clave, the movie, a third to La Clase, and a third to a TED Talk, the control condition. And then at the end, we asked them, we presented a case, much like the Olga case that I pointed out. We called her Elsa. And we asked, what's going on with Elsa? Well, if you received the TED Talk, almost 2/3 attributed primarily to their divorce or difficulties that she was having in her social world. But if you received the movie or the class, less than a quarter made reference to social world. And then if you received the TED Talk, less than a quarter actually referred to any psychotic illness or symptoms that were present in that case. But if you received the movie in the class, over 2/3 and up to 80% identified the psychotic illness and made the illness attributions. So that's just one example of how it's are evident. So that's a little bit about the message. And then in terms of how we carried it out, we had 2 full-time community coordinators, Rosalba Kane and Eva Torres, wonderful folks, very committed to the community. We had a media firm, experts in working with the Latino community in terms of getting out the word, and then Professor Do Mayer, who's here in the School of Cinematic Arts, an expert in using social media in health and education. She was really important, and particularly with the movie, and giving us a sense of how to carry out a campaign in a community. So these are some pictures. So here's Eva Torres. So we spend a lot of time in the swap meets here, passing out brochures and talking to people. Here's one example. Eva and Salva went to health fairs here. They met with a congressman in the local area. We spend time at, like I said, churches and religious organizations. This is a Saturday morning CCD course. Here's Eva. I'm in the background, took this picture. Spend time with ministers, Catholic, Christian, other denominations. They're very important. Here's professional organizations here. She's talking to a group of mental health providers. Law enforcement was really critical. Rosalba and I spent a number of times on roll call, getting the word out to law enforcement. We're in the newspapers. Here's the Spanish language newspaper La Opinión, it's well noted. We were on television and radio. This was VPE, our media consultants. They really worked hard to get us in newspapers, to get us on the radio, to get us in TV. It took a while, but we finally were on there. For example, one day we were on there for a 30-minute program, and our particular program was highlighted. We were in billboards. We planted billboards actually for only a month. They last a little bit longer, but you can see we tried to get, this was our target area. There are 6 zip codes in particular, 60 junior poster boards. Here's one example of that. And then we were on bus benches. We thought it was important to reach our community and bus benches as well. And we had a website. So that gives you an idea of the message and how it was delivered. We evaluated whether or not the message was received or was delivered. And these are just a number of ways that we did so. So for example, Rosalba and Eva, and sometimes I contributed to workshops, monthly workshops. There are about 20 people showing up. This was an hour and a half presentation using La Película, La Clave, the movie. They also would go to beauty salons, and as mentioned, swap meets, Vallarta, a local supermarket chain that provides groceries to Latino community. So we had very positive feedback. VPE, our media consultant, estimates that we had 23, almost 24 million impressions given the various placements of our message. And then we had a 1-800 number. The 1-800 number was set up so that we could record how many people, based on our campaign, actually called the clinic. We had one number calling the outpatient clinic. And so you can see that at different points, when we had our bus bench and junior posters, this is the number of weeks of the second year, and you can see there are a number of phone calls that were made in a given week, and you can see that. And when we were on TV, we had the most phone calls during that 2-week period. So it was clear that the message was delivered, and there's some evidence that it was received. And this is one really good example of the fact that the message was received. This is a case of Sergio, and Rosalba told me that this father said, you know, my son has all these CLAVE indicators. And so Rosalba said, call the 1-800 number. Didn't call. He would text Rosalba and saying he's starting to act out more. And Rosalba said, call the 1-800 number. Didn't call the 1-800 number. Finally, we learned that the son took a television and broke it, threw it down, was very aggressive. So he called the police. The father called the police. Police showed up and said, the police showed up, and the father said, I want you to take him to drug rehabilitation. And the police said, we can't do that. We can take him to jail, or we can take him to a psychiatric hospital. He said, no, he's doing drugs. Take him to drug rehab. He says, we can't do that. But the police said, because they've been to our program, they said, they have a program called La Clave. Well, he had heard about La Clave. He says, take him to the psychiatric hospital, because Rosalba had gained the confidence of him. So this is an example where getting multiple folks not getting to be knowledgeable of La Clave help facilitate. It's not just about a single instance of learning about what the symptoms are. It's having a dialogue, a conversation, as reflected in that case of Sergio. So the main way in which we assess this is that with the cooperation, collaboration of Dr. Alex Kapelowitz, we would assess how long it took people in their first episode of psychosis coming into an outpatient clinic, the San Fernando Mental Health Clinic, or coming into an inpatient unit, all of you, or the psych ER. And so we had people who would, we would send our research team and evaluate how long it was taking for these first episode folks. So this gives you an idea of some of the characteristics of folks who are in our sample. We have a larger N. It's up to 130 now, but these are some of our preliminary data. You can see they're largely men, largely US born, and they both speak Spanish and English. And so what you can see here is that the duration of untreated psychosis, or the delay to any treatment, I mean, if they go to a school counselor, if they go to a physician, or if they go to mental health, it's about, the mean is about 2 years. And then first prescribed medication is almost 3 years. So one key message is that there is a delay in treatment for our particular sample. Now, did the campaign make a difference? The way we like to see it is that the data are suggestive that it made a difference for onset to any treatment. In other words, it got them outside the family, not to starting antipsychotic medication or not to mental health treatment, but it may have reduced the delay in seeking any kind of treatment. So you can see this here, for example, in baseline, it took on average 112 weeks to get into treatment. During the campaign, it lowered to 75, and then once the campaign ended, it increased to 157. Now these are preliminary data, and the untransformed evidence suggests that the campaign may have made a difference, but the way we like to consider it is it's suggestive that the campaign may have made a difference. The other key finding is that the immigrants took longer. This is for any treatment, duration of untreated psychosis for any treatment, and duration of untreated psychosis to starting antipsychotic medication. You can see that the immigrants took longer. So just to wrap up, is that overall Latinos have a long duration of untreated psychosis. The message was delivered and received, we believe. And the campaign may have contributed to a reduction in time to any treatment seeking, but not to starting mental health services or not just beginning of antipsychotic medication. And the last key finding is that immigrants have a significantly longer duration of untreated psychosis than US born. So we learned a lot. This was a wonderful opportunity to figure out how to carry out these campaigns. And a couple of key messages I want to leave with you is we were outside the mental health service. We did not work within the mental health service. I think it would be really helpful to have a campaign or people working on the campaign who work within the mental health service. That referral to the outpatient clinic or the psych ER, et cetera, would be enhanced if we had clinicians working within the service itself. The other thing is that we waited to the end to think about sustainability. We should have started from the beginning. We started training people in the community, collaborators, in the last 6 months of the 2-year campaign. We should have done that at the very beginning. You want to get as many people out there as possible who are familiar with the campaign. So those were two key recommendations for future directions. So in wrapping this up, we believe that our program gives us hope that we can reduce the duration of untreated psychosis in high-risk groups such as immigrant minority communities, and not just our study, which is suggestive, but also the 3 or 4 studies that have been successful. And we think by doing so, we're gonna reduce the significant burden on folks with serious mental illness and their families as well. And we're very open to consulting with folks. We have a project in Kern County. We're exploring other counties as well here in Southern California, but be very interested in working with other communities in other parts of the country. I want to point out our key collaborators, Conceptual, Alex Kapelowitz, critical person in recruiting, and longstanding colleague, Dr. Carmen Lara in Puebla, Mexico, where we've conducted a lot of the initial studies in terms of psychosis literacy. Bill Mayer, in terms of the social media, Jody Ullman, in terms of analysis, and Bill Vega, longstanding Latino mental health researcher, played an important role in our community survey. So here's the contact information, and I welcome any comments or calls at this particular time. Thank you very much.
Thank you, Dr. Lopez, for a great presentation. So we do have a few questions.
Okay.
You presented some data on changes in delaying treatment in terms of using La Película or using the class or the TED Talk. To what do you attribute some of the differences with the TED Talk?
Some of the differences with the TED Talk.
Yes.
Okay, so the TED Talk, I didn't explain that, so that's a good question. The TED Talk was about social ecology or el medio ambiente. And so it had nothing to do with mental health. It was about the same length of time. And then the clase and película were about mental health and la clave. So the TED Talk was an excellent TED Talk. We asked the respondents to rate how engaging and how much they got involved or listened and valued the actual talk. And it was just as highly rated as the movie and the class. But the content was not at all, had nothing to do with mental health.
Okay, thank you. There's another key finding that you presented in terms of differences with US-born versus foreign-born Latinos.
Right.
Do you have some plausible explanations for the differences in terms of longer waiting periods for foreign-born?
We don't have any quantitative data to point out what the factors are. And we're really just getting into this. But a couple things come to mind. First of all, in a prior study that was published in Psychiatric Services, we looked at the psychosis literacy of caregivers and people with first episode psychosis. And immigrants had lower psychosis literacy among caregivers and persons with the disorder. So one factor might be their psychosis literacy, their understanding and knowledge of psychotic illnesses. That's one factor. Another factor is just knowledge of the whole mental health system. A colleague and friend of mine, Nelly Salgado Snyder, has done a lot of research both here in the United States and in Mexico on mental health and health-related issues. And she always says that when people come to the United States, they don't leave their cultural baggage behind. They bring that with them. So in Mexico, the health system is so different than the health system here. And that's a factor. Just knowledge of the healthcare system and how to address that. And then the third thing I'd like to say is that when we've given these talks, sometimes a mom will raise her hand and say, well, I can't go to that clinic because I don't have any insurance. And they don't know that at this particular clinic, you didn't need insurance. Or another person will say, well, they can't use services because they're undocumented. And they don't know that at this particular clinic, they don't ask for their immigration status. And so the fear, particularly in this climate, but also just a lack of knowledge that people can access and use the services, even though they may be undocumented, even though they may not have insurance, or they may not have the wherewithal, financial wherewithal. Because in this particular clinic and a number of county clinics, if you meet criteria for indigent, very low income, you can get the services for free, medications for free. And so a lack of knowledge of these played a role. So those are probably some of the factors.
Thank you. You also mentioned sustainability. And is that an effort you're working on, maybe training more promotoras or other folks in the community?
Yes, sustainability is really important. And we didn't do as good a job at that in the San Fernando Valley as we would have liked to have done. But we're working with Kern County now, and we're just beginning. And we have been very clear that we want to train not just the team within the behavioral health services, but also stakeholders, collaborators, get as many people as possible and train them. And so I think that's really important. And we believe that our resources, like La Clase, La Película, La Clave Sin Luz, are all resources that can be easily used by folks with little education. In fact, La Clave Sin Luz that we tested in Mexico, some of the promotores had very limited education, and La Clave Sin Luz has very few words in it. That's why I wanted to use images and telling a story and narrative versus a classroom setting where there are a lot of words. So we think that the resources lend themselves to being used by a large number of folks to enhance the sustainability of the campaign.
Thank you. And related to that, would you consider developing other tools for other mental health disorders similar to La Clave?
Sure, we would be open to that. We chose La Clave and Psychosis because if you look at the literature, there are a number of initiatives for depression, a number of initiatives for anxiety, and substance abuse. And we saw that much less attention to psychosis. Clearly, there are more folks with anxiety and depressive disorders, but the burden for psychotic disorders is really significant, as is for the other disorders. But we'll be open to that. We'd be open to exploring that if somebody wants to collaborate with us. And yes, give us a call.
Perfect, thank you. So for our presenters, you mentioned there's a website, laclave.com, is that correct?
No, it's uselaclave.com.
uselaclave.com, just so our participants can everyone
right
access some of the tools? Yes, there you go.
So if you go to laclave.com, it's I think an Argentinian newspaper.
Okay.
But if you go to uselaclave.com, you'll find our website. And I should point out that you could go click on recursos, and then if you put in the password, which is clave, by the way, you can watch the film, you can watch the La Clase, and you can use it with your community. So check it out.
Thank you. Okay, so I think that's it for questions. Thank you so much, Dr. Lopez. Again, I would like to thank you for taking the time to collaborate with us and provide the webinar, and also for our participants for attending. So thank you so much.
It's my pleasure. Thank you for inviting me. Have a good day.
You too.
This concludes today's webinar. I would like to thank today's presenter and remind our audience that if you're interested in receiving further training on this topic, you may email us. Please look at our website to learn about future webinars and other services we can provide. As you leave today, you will be directed to complete a brief survey about your experience. Your feedback is very important to us, and we appreciate you taking the time to tell us what you thought of today's webinar.